This is Respiratory System video number 2, and we're picking it up from where the glottis is, here and here. Notice that looking from above, we're looking down. Okay, this is the back of the tongue over here. And then we have our vocal ligaments right here, and they're closed. Okay, this is referred to as the glottis. Here, you can hold your breath and not let the air flow. So you can try that out. And over here, you can abduct the vocal ligaments and let the air flow. And how do we do that? We do that by using the posterior Cricoarytenoid muscle. Posterior Cricoarytenoid, arytenoid, arytenoid muscle. Posterior cricoarytenoid muscle. Who innervates it? It's innervated by the vagus nerve, cranial nerve number 10. Does this. Okay, so you don't want to hurt that nerve. How can you hurt that nerve? Sometimes you can do it with a tracheotomy, sometimes by surgically removing the thyroid gland. So one has to be very careful with that surgery. Okay, then we move on. Here is the cross view of the trachea with the esophagus. Notice that the esophagus fits in very nicely right here. And so if one is swallowing some gigantic pill of some kind or another, notice that we can actually sort of push in this way to allow the passage of a very large food bolus or a large pill. Okay, here we have the trachea. Notice that it has a lot of cartilage associated with it, and it's got these, shall we say, 4 layers. We have the mucosa, the submucosa, the hyaline cartilage or muscle at this layer, and the adventitia, the outer layer. And here we have the micrograph. The micrograph is showing us this mucosa here. This is pseudostratified columnar epithelium with cilia, see the cilia, and the goblet cells that form mucus, which is, of course, the problem of COVID-19, too much mucus. Okay, we'll get into that sometime. But anyways, here we have the tissue, just the way you like it. And then we have the submucosa here, which is transidating, or that is to say, allowing the flow of vessels and nerves. And of course, there's going to be lymphocytes and macrophages here. And then on the deepest area here of this photomicrograph is going to be the hyaline cartilage. So this is hyaline cartilage. It's the cartilage that makes up your trachea, the circular, how shall I say, hard ground substance areas, hyaline cartilage. Notice over here we have the bronchial tree. Okay, we have a trachea right here coming down, and again we're having a left bronchus, primary bronchus. The left primary bronchus serves a lung. A secondary bronchus, which is the branch here of a primary, it's going to serve a lobe. There's only 2 lobes in the left lung. And then we have something called a tertiary bronchus here. And that's going to be serving a portion of a lobe that's referred to as the Bronco Pulmonary segment. Hopefully, if you get a respiratory illness in the lungs, lower respiratory, it's limited to a bronchopulmonary segment, which has its own artery, its own vein, its own tertiary bronchus. So it's separated, and hopefully the illness can be confined. If it gets worse than that, then it could go to the entire lobe. We have something called Lobar Pneumonia, in which the entire lobe is considered. Here on the left, we have just the superior and the inferior lobes. Over here, we have the superior, middle, and inferior lobes. Here we have a horizontal fissure. Here we have a oblique fissure oblique fissure only on this side. Over here, it's not showing so well, but we have something called a lingula that wraps around the bottom of the heart. Here's the cardiac notch, here's the lingula. Okay. Then when we finally get out to the end here, we get to something called a terminal bronchiole. So after the tertiary bronchus, we have bronchioles, we have a terminal bronchiole, the last of the bronchioles, and then after that, notice that we have these little bubbles here called alveoli for the purpose of breathing. And now we're calling this little unit here a respiratory bronchiole. Okay, here we have the alveolar sacs, and then finally we get out to these sort of grape bunches out here, and these are alveolar ducts leading to the larger alveolar sac out here. Notice that the alveolar sacs are completely surrounded by capillaries. The idea here is that we're going to be picking up oxygen from the air and getting it into the blood. And also the blood is going to be carrying high concentrations of CO2 that we're going to be transmitting back to the air and breathing that out. So that's the nutrient exchange here, is that we're getting the nutrient oxygen in exchange for the waste product CO2. That's the idea. Over here we have a, shall we say, typical alveolar sac, just the way you like it, right here. Notice that we have little pores so that one sac can share air with another sac in small amounts. Notice that if we look closely at these individual cells here, we're going to see the type 1 cell, which is actually a simple squamous cell. Type 1 alveolar cell, simple squamous. Type 2 alveolar cell is a cell that secretes surfactant. If you look at water, water has a surface tension. If you add Joy liquid to your water, the surface tension relaxes into bubbles. So that's kind of like what's going on here. A suction cup will press up against a hard surface, flat surface, and be stuck, like an arrow with a suction cup head that gets wet. You can actually shoot the little arrow at your mom's refrigerator and it will stick, right? And so in this case, if you add soap to the situation, or surfactant, the little arrow won't stick. It will fall off. It makes breathing easier. You don't want to have just pure water here because the hydrogen bonding of just pure water makes breathing difficult. And so little babies who are born prematurely do not have mature type 2 cells, and so sometimes they're not producing enough surfactant, and we have to put them on respirators, which is the key element of the disease we're currently in, and COVID-19. And so the respirator is gently pushing in air. It's, in this case of the premature baby, it's got some surfactant as an aerosol that's going with it. Okay, we do have capillaries. Here, if you look very closely, it's basically a simple squamous cell that is circling around here. Here we have a macrophage. A macrophage is going to be also called a dust cell in this particular case. They don't mention that. But it's sort of crawling around here, picking up particulate matter and ingesting it and digesting it. Over here, we have what's called the diffusion gradient, or diffusion barrier, it's sometimes called. It's made of three things. Basically, the oxygen has to go on to the red blood cell from the air inside the alveolus. The CO2 has to come off, right? And we have to cross this great divide here. And it's made up of an alveolar type 1 cell. It's also made up of a capillary simple squamous or endothelial cell, and they have a shared basement membrane. So it's a little 1, 2, 3. Alveolar cell, fused basement membrane, capillary cell makes up the diffusion barrier. Okay. Over here we have a picture of the bronchopulmonary segments, and you can sort of count them up if you like. This picture in your book shows you how many there are on each side. And that concludes this particular episode, and we'll continue on with episode 3.